Thank you all for joining us today as we delve into an innovative approach to homelessness prevention. I'm Karen Clary, and I'm the director of the Homelessness and Housing Practice at the Government Performance Lab within Harvard's Kennedy School. I'd like to begin by acknowledging our Harvard University co-sponsors for today's event: the Initiative on Health and Homelessness at the T.H. Chan School of Public Health, the Joint Center for Housing Studies, and the Advanced Leadership Initiative. This is the sixth of the co-sponsored series that we've launched in the past year and a half towards the goal of creating a cross-disciplinary academic home at Harvard focused on homelessness and housing. Their support has made this gathering possible, and we are grateful for the opportunity to create shared platforms for practitioners and academics to explore new strategies in addressing housing insecurity. The context for today's discussion is particularly urgent. Across the country, homelessness rates are on the rise, exacerbated by a severe lack of affordable housing and compounded by recent economic and social pressures. Many are wondering how the change in administration will impact these trends, bringing to even greater prominence the question of how can we prevent homelessness before it happens? Preventative measures are critical to addressing the root causes of homelessness, reducing both the strain on emergency response systems and the scramble for scarce housing resources. At the Government Performance Lab, we collaborate with state and local governments across the country to design and implement solutions to pressing social challenges. Our homelessness and housing team specifically focuses on testing innovations that, number one, prevent homelessness before it happens, two, make the rehousing process more efficient, effective, and equitable, and three, directly invest in the skills of the homeless response workforce. Our team's learning agenda around homelessness prevention is focused on better understanding the pathways leading into homelessness and possible upstream intervention points. Today, we're fortunate to hear from two leaders in this field taking an innovative approach to upstream prevention, using administrative data to identify individuals most at risk of housing insecurity and then proactively offering them services. First, Janey Rountree is the executive director of the California Policy Lab at UCLA, where she leads a team of researchers working in partnership with government leaders across California. She has a specific focus on homelessness and has co-authored multiple papers on homelessness prevention. Prior to joining the CPL, Janey served as Mayor Rahm Emanuel's Deputy Chief of Staff for Public Safety in Chicago and as a senior counsel for Mayor Michael Bloomberg in New York City. Then, Dana Vanderford is the Associate Director for Homelessness Prevention at the Los Angeles County Department of Health Services, where she has led the design and implementation of the Homelessness Prevention Unit since its inception in July of 2021. She has supported housing and services work across the county's homeless response for the last 7 years. Prior to joining the Department of Health Services, she served as the Homelessness Policy Deputy for Los Angeles County Supervisor Catherine Barger and has previous experience in both public education and public affairs. Welcome both Janey and Dana. We'll start with a presentation by Janey and Dana, followed by a moderated Q&A to explore their program's origins, challenges, and outcomes. We'll have a chance to take a limited number of questions from the audience, so please feel free to post questions in the chat throughout the session, and we will circulate materials following the presentation. Thank you all for joining us, and we look forward to a meaningful conversation. Janey, I'll hand it over to you.
Thank you so much for that introduction. Welcome, everyone. It's such a pleasure to be here. And I'm just going to start the slide deck. Good afternoon to everyone on the East Coast. Good morning to folks here in California. We're going to be talking about predicting and preventing homelessness in Los Angeles. You're looking at a photograph of Ricky Brown and his grandson Zion. And in 2023, Ricky received a phone call from Los Angeles County Department of Health Services. And the phone call sounded something like, hey, we wanted to check in on you. It's been a really difficult year for LA residents. Wanted to check in on how you're doing and whether your housing is secure. And there would have been an offer for immediate assistance, particularly to buy gas or food, with the option to enroll in a program and receive longer, more intense assistance. And Ricky received this phone call because our research team here at the California Policy Lab, UCLA, developed a predictive model that predicted Ricky to be a very high risk of future homelessness. So today we're going to talk about how that work evolved and why Ricky received that phone call, and then you're going to hear more about his situation and his family later in the webinar when Dana talks about the Homelessness Prevention Unit. The partners for this project include CPL, my research, or our research organization, the LA County CEO, Chief Information Office, and of course, the Los Angeles Department of Health Services, which is the lead on the Homelessness Prevention Unit, and a partnership with Department of Mental Health. The project is funded by the Conrad and Hilton Foundation, the University of California, and the James Irvine Foundation here in California. And for many years, it's received a lot of advice and input from the California Policy Lab's Community Advisory Board, which includes a number of people with lived experience of homelessness, as well as our peer technical advisory board that has experts on predictive modeling, AI, ethics, and particular expertise on causal impact evaluations. The California Policy Lab is a nonpartisan research institute. It's based at the University of California and has 2 locations at UCLA and UC Berkeley, but we have research affiliates at dozens of different UC campuses and other research institutions. And I think the thing to know today about how CPL operates is that we work in long-term research partnerships with government agencies. We don't work at the project level. So just as an example, for homelessness prevention, we started with 1 project, but we now have 8 or 9 multi-year research projects focused on homelessness prevention that are building on each other. And each of these research partnerships is really based on a data sharing partnership. So CPL offers expertise in secure, privacy protected data hosting and data linkage for our government partners. And of course, we're focused on trying to build evidence-based solutions for key public policy problems here in California. And then we work across these 6 policy areas. Homelessness is our largest area in our Los Angeles site, but we also work on criminal justice, the safety net, education, health, labor, and employment issues. And of course, if you're experiencing homelessness, each of these systems is affecting your life in various ways. So if you're taking a human-centered approach, you need to see data and understand how all of these things are interacting. So I'm going to start today by talking a little bit about our motivation for doing this project and give you a little bit of the policy background here in Los Angeles. So as Karen already said, the pace of growth of people experiencing homelessness is outpacing our ability to house people. In the most recent year, Los Angeles housed roughly 25,000 people who were experiencing homelessness. That's the highest number ever. So we're definitely expanding our ability to house people, but we can't keep pace with inflow. Between 2018 and 2024, here with our point in time count, we saw a 43% increase in the number of people experiencing homelessness. And in fact, in the most recent point in time count in Los Angeles, 68% of people surveyed were reporting experiencing homelessness for the first time. So there's a huge increase every year of the number of people falling into homelessness. And I think policymakers here and nationally understand that solutions for homelessness have to include prevention. How do we reach people before that happens? So what do we know about how to prevent homelessness? I think we have to start with some key facts about what we know about people who are newly homeless. There was a statewide survey by the UCSF Benioff Center that you may be familiar with. When they asked people who were on the streets across California, a number of people said that a one-time payment of $5,000 to $10,000 at some critical moment could have helped them avoid the financial crises and prevented their homelessness altogether. So that's a signal that short-term or one-time cash assistance might be helpful. Another really critical thing to understand about homelessness, particularly in California, is that most people who are homeless are not becoming homeless immediately from leaseholder situations or other situations where they could have been evicted. So again, the statewide survey revealed that 32% of people experiencing homelessness are leaseholders. 49% are coming from informal living arrangements, often called couch surfing or being doubled up. 19% are exiting institutions. Those are largely either being incarcerated or coming from a drug treatment facility. So the key thing here is that a a homelessness prevention program that's going to reach people at highest risk of homelessness can't be limited only to eviction prevention. Eviction prevention is essential, but it cannot be the only mechanism for supporting people. So what else do we know from prevention? There's a growing body of rigorous evidence, especially over the last 3 to 5 years, that short-term cash assistance does seem to work. And a recent study by the Notre Dame Lab for Economic Opportunity was a randomized control trial of a prevention program in Santa Clara County, California, and it did find that cash assistance reduced homelessness. So there's a lot of optimism here that we can prevent homelessness. But we also know from research that it's very, very hard to target. It's hard to know who is going to become homeless without assistance. And in fact, in that Santa Clara study, it was a randomized control trial. So you had a treatment group and a control group. And the prevalence of homelessness in the treatment group, the people getting assistance, was 1%. The prevalence of homelessness in the control group was only 4%. So that shows you a big impact of the program, but also it's very hard to target. The vast majority of people, even if they're reaching out for prevention services, are not at high risk of homelessness. In Los Angeles, you're going to have millions of people enrolled in public benefits programs, and very, very small percentage of them are going to end up enrolled in homeless services. So we felt like this was a key case for using artificial intelligence or predictive modeling. And what we really wanted to know was, could we build a predictive model that would help target prevention so that scarce prevention resources are going to people at highest risk of homelessness? So for the rest of the presentation, we're going to try to answer some key questions about predicting and preventing homelessness. So the first thing we're going to try to answer is, could we build a predictive model that would identify people at high risk of homelessness? Of course, we have to ask whether that predictive model is equitable in the way it's identifying people at high risk. Who's on these risk lists? Who is being identified as being at high risk? And what would we need to know about those people to build a prevention program? What service model would be needed to outreach to and serve those individuals? What are the results for clients so far? And then time permitting, we're going to touch on how are we actually evaluating the impact of the program, which is ongoing. So let's start with the predictive model. The predictive model, one key finding of our research paper released today is that the predictive model does in fact identify people at high risk of homelessness. So to build this predictive model, we're working in a really unique environment in Los Angeles where LA County has made progress linking together individual level de-identified data across a number of different types of county services, including, of course, homeless services, the health system, things like emergency department visits, inpatient, outpatient care, all of the major public benefits program, including SNAP, TANF, General Relief, Medi-Cal. We're looking at data from the criminal legal system, including contacts with LA County Sheriff's Department and Probation Department. And all of these data are linked together and create a rich data source in which to identify features that might predict homelessness, including 580 different variables. We're aiming this at the outcome of homelessness, which we're observing actually through a couple of different data sources. The main one is enrollment in homeless services, or the HMIS data, but we add homelessness flags from safety net programs to enrich our observation of homelessness. That's particularly important in California when many people experiencing homelessness are disconnected from services. So we built this data in collaboration with LA County CIO, and we're going to use it to try to predict the outcome. So here are the specific parameters of our prediction problem. We start with a group of about 100,000 people who are eligible for prediction. And these are people who were recently enrolled in a county health service or county mental health department service. They had a recent safety net enrollment where they listed a physical address. And that gave us about 100,000 people. We had to establish those parameters because the Homelessness Prevention Unit, and you're going to hear more about this, had to actually go out and find these people. So we needed people with a recent service contact to make them easier to find and to ensure that we were finding people who are still housed and eligible for prevention and were not already homeless. So if you take a look at this group of 100,000 people who are county service users, the prevalence of homelessness in the base sample is about 7%. So it's already higher than the general population, but it's still only 7%. So how well does this predictive model do? We generated a risk list of 10,000 people. The size of the risk list was determined by a couple of factors, including the limitation of the intervention, but also the study design. And of that 10,000 people, 24% were predicted to, or actually experienced the outcome of homelessness. So the people on the high risk list are about 3.5 times more likely to experience homelessness than the sample. We're using here a general precision score to figure out if the model is effective. Our paper that we released today goes through a number of different tests that we applied to the model, including things you might be familiar with, like area under the receiver operating curve. If you're interested in those details, we'll definitely make sure you have a link to the full paper. So we've predicted homelessness. Oops. And now we're going to talk about the equity of these models. This is always top of mind when we're talking about artificial intelligence or predictive models that are running on data that might be biased in the way that it's collected. And before I get into how we evaluated the model for equity, I wanted to provide a little bit of context about equity and homelessness. So homelessness, as you no doubt know, is highly racialized. There are a lot of structural racism that is driving people into homelessness, including things like discrimination in housing markets, labor markets, discrimination in the criminal justice system. And it's led to a situation in Los Angeles where Black people, who are 10% of the general population in LA, are 30% of people experiencing homelessness. So homelessness prevention, the main policy goal is to prevent people from experiencing that outcome and prevent them from being on the street or having to live in an emergency shelter. And we're trying to help the county advance that goal, which is part of a larger policy agenda around reversing the harmful effects of structural racism. Just because that's the intent doesn't mean that we're accomplishing that. And we still also have to make sure that the way that the prevention program is set up and the way that it's finding people is also equitable. So now I'm going to show you how we evaluated whether the model itself is finding people in an equitable manner. There are a lot of different ways that you could evaluate predictive models for equity. And you have to pick one that is policy relevant. In this case, the predictive model is selecting people for a new intervention that they wouldn't otherwise have access to. And so the key equity measure is whether the model is making mistakes about leaving people out at different rates. So we want to make sure that the error rate, or the rate at which it leaves people out of the model, is equal across different racial or ethnic groups. And what you're seeing here on this bar chart is that the error rate, or the false negative rate, across these groups is roughly equivalent and slightly lower for Black individuals. It means that Black individuals are more likely to be enrolled in HPU, or slightly more likely to be enrolled in the homelessness prevention unit than other groups. And when we presented these results to the county, they felt that this was a good result. Otherwise, you'd have to engineer the model to deselect people who identify as Black. So you want to make sure that you're picking an equity evaluation that matches your use case. And again, in this particular case, we want to make sure it's not leaving people out or leaving them out of the opportunity to enroll in HPU at different rates. So I'm going to talk a little bit now about how the model, the people that the model identifies as being at high risk, and make a couple of points before I turn it over to Dana to talk about how they design the intervention. So to continue this conversation around equity, one of the most interesting things we found when we developed the model is that it was identifying people who were completely disconnected from other types of homelessness prevention in LA. So you're seeing these overlapping circles. The HPU high risk list has roughly 10,000 people on it. The people enrolled in other prevention programs, 2,500, there were only 42 people that were on both lists. So this is critical, because what it means is that the predictive model is identifying a group of people who are otherwise disconnected from homelessness prevention and giving them an opportunity potentially to receive assistance. It also means that these two programs don't replace each other. A healthy prevention ecosystem in LA should have both strategies, because it's possible that both of these groups are high risk, but potentially for different reasons. So this is really adding, I think, an opportunity for people who are not otherwise enrolled in programs to access prevention. The other critical thing that we observed right away is that the people on the high risk list have much higher physical and mental health needs, and are very vulnerable. And so the intervention needed to be designed, needed to meet where these clients where they are. That's not necessarily surprising because the predictive model is identifying people using all these service history data. So what does that look like? You're looking at a comparison of people enrolled in the HPU or on the high risk list, which are the light blue and orange bars, compared to other homelessness prevention programs. So we're not comparing them to the general population, we're comparing them to people enrolled in homelessness prevention using different targeting strategies. And here you can see that the rates of diagnoses related to mortality, diagnoses related to serious mental illness, substance use, their criminal justice histories are significantly higher for this group. So this was really important information for the county in designing the HPU. And at this point, I'm going to turn it over to Dana so she can talk about how they did that.
Thank you so much, Janey. I'm excited to be here today with you all, excited to move from discussion of the model into how we serve the folks that the model identifies. Janey, can you advance my slide for me? Thank you. And want to return back to our client highlight. So talk a little bit more about Ricky Brown, whose image you saw with his grandson at the beginning of the presentation, with his wonderful case manager, Fred Theus, on our team. I think Ricky's story is a great example of why we do the work that we do here at the HPU. When we first met Ricky, he had just assumed custody of his 3 grandsons, and all 4 folks were living in a 1-bedroom apartment in South LA. He had recently lost access to benefits, so the family's income was of grave concern to us. He was no longer receiving CalFresh or CalWorks to help sustain food or income for the family. And we're so glad that Ricky said yes to enrolling in our program. We worked with Ricky to reconnect to benefits. So by the time the family was done with our program, they had CalWorks reinstated and Ricky was receiving cash aid to help support the family. We assisted with some transportation needs for the family. And this is a family that we have kept in touch with, so I'm excited to share a recent update on the Brown family. They are on their way now, months beyond their point of discharge, to connecting to a Section 8 voucher. Which will allow them to move into a 2 or 3-bedroom home, likely in North LA County, with more space for the kiddos. And although that's not a direct outcome of the time that we spent with the Brown family, we think it is a long-term success story that does result from the advocacy, the resources that we connected the Browns to when we were with them. So we love this picture. We love sharing success stories of our clients and our staff. And so wanted to return back and share some good news on the Brown family before I proceed. Go ahead, Janey. And I'm going to take you now from generation of our high-risk list all the way to program enrollment. So as Janey mentioned, we work in partnership with CPL and with the Chief Information Office of the county to produce our high-risk list. That list is produced kind of dependent on unit capacity. So when we need more clients, we ask for a new list of folks. Our wonderful data team in-house does some client re-identification at that point, some additional screening. It's sort of light eligibility testing at the front door of our unit. We're hoping to find out if the clients that we're about to outreach to are currently housed from the best of our ability to tell in the administrative data. We don't want to be reaching out to folks who appear to already be experiencing homelessness. So we do a little bit of re-identification and eligibility testing at the front door. Clients are then randomly selected into our treatment or control group. And then clients who are selected into the treatment group are those who are eligible for our proactive outreach, which is a really fascinating process. And I'm going to talk more about that in a second. The clients who are able to reach, who say yes to enrolling in our program, then move into program enrollment. And I'll talk more about the services that they receive from our program in just a moment. So proactive outreach is a critical component of our program and is quite interesting. We are cold calling our clients. We are sending letters. We are sending emails to our prospective clients in a way that feels to them very out of the blue. And it's challenging. We have clients who have understandable mistrust of systems, who are skeptical about the phone call that they're receiving that offers flexible financial assistance. We also are working, as Janey mentioned, with clients who are living with complex health and mental health challenges. So clients who do not consistently have their phones on are challenging to reach and challenging to serve. So those cold calls go a lot better than we thought they might at the beginning, but are still challenging, and we have a tough time reaching our prospective clients. So if you look at the data here, this is from a period between May 2022 and October 2023. Reached out to over 2,000 folks, and of that population of prospective eligible clients, only 1 in 5 enrolled. And that was in large part because we could not get in touch with them. We saw lower enrollment rates on our single adult side. We serve both single adults and families. We have some hunches about our family's level of connectedness that might result in sort of an easier ability to contact than our single adults who perhaps have higher acuity levels, higher risk levels. So we get better in touch with families than we do in single adults. And being unable to contact folks was the primary reason for lower enrollment rates. So when we do get somebody on the phone, we have a lot of success in getting those folks to a yes, but still face some challenges in connecting with folks in the first place. I'm excited to talk more about the program model. So while the way that we find our clients we feel is very unique, the use of predictive analytics to generate our high risks list is of course unique for a prevention program, but the way that we have intentionally designed our model is quite unique as well in the world of prevention services. So as I mentioned, we proactively outreach to our clients, we send letters, we make 3 phone calls over 3 weeks to our prospective clients for every phone number that we've been able to gather for them. We send email addresses to every email address that we've been able to gather for our clients. I'm really proud of our persistence in our proactive outreach. We get plenty of clients who, we've called once, we've called a second time, and on the third time they answer. And they'll say, I got your messages, I was going to call you back, but I just hadn't gotten around to it. So I would describe our approach as measured but persistent, and I think it really benefits our clients there. Clients who say yes to enrolling in the program are assigned a case manager that they'll work closely with for the next 4 to 6 months. And the intervention they receive after enrolling in our program is sort of threefold. Very responsive, intensive case management support from case managers on our team. They receive flexible financial assistance at a pretty significant level. So on average, our clients are receiving about $6,500 in flexible financial assistance. We really let our clients drive their spending. So of course, we assist with things like rent, utility payments, but we also help our clients resolve any debt that they might have. We'll pay off a credit card. If they have transportation needs, we'll fix their vehicle or buy them a new vehicle. Whatever our clients identify as their short-term financial needs, we try to make those sort of dreams come true for them and provide that immediate relief. And then we make linkages to supportive services. So as Janey mentioned, our clients are frequent visitors of DHS emergency rooms, are frequently receiving crisis stabilization holds from our Department of Mental Health. So we really want to plug our clients into long-term systems of care, primary care physicians that they love and will visit regularly, mental health providers that they'll visit regularly, connections to legal services, immigration services, to really provide wraparound care on a long-term basis for our clients. We really believe the financial assistance helps in the immediate, and we think that the linkages to supportive services and to systems of care will really help our clients sustain their housing long-term. There's a couple other key features of our program that I want to mention here that we're extremely proud of. We've tried to build a program that is accessible to our clients. So of course, we're reaching out and sort of appearing in their lives out of the blue. It's also been important then that we make sure our program is as accessible as possible for those clients. So we're pretty low barrier from a documentation perspective. If clients are on our list, they're largely eligible for the program. So there's no additional documentation up front that clients need to provide to us to prove eligibility. We can serve non-leaseholders. We can serve folks who are doubled up. We can serve folks who are couch surfing. So really trying to work upstream with folks who are right on the edge of losing that last housing resource. And the flexibility there, I think, has been key for our program. We built an HP-specific family definition that we're very proud of that we feel is reflective of the living situations that folks find themselves in here in LA County. Again, serving doubled up populations, serving multi-generational households, understanding that adults here in LA County have dependency relationships between each other, and that's been reflected in our family definition. So those are the folks that are served on the family side of our shop. Our program is client-centered, so the financial assistance is flexible. It moves quickly to get into the hands of our clients. Our clients' housing and services plans are driven by our clients and their needs. So there's no mandate that a client must connect to a mental health provider in order to receive the financial assistance. We really let our clients drive their experience with our program. The next two or a couple items relate to program design that we've been intentional about as it relates to our staff. We have low caseload sizes, so a 1 to 15 case manager to client ratio, which allows our case managers to really provide tailored hands-on support to our clients. We've got tons of built-in support staff, so we have a dedicated outreach team. We have a linkage program manager. We have an in-house housing navigator to help our clients who need to move. So case managers are not alone in the assistance that they're attempting to provide our clients. There's tons of built-in support staff and tons of collaborations present on the unit. We're really proud of our staff retention. We believe that case management services can only be high quality if staff is happy and well taken care of and stays, and can really be a source of consistency in the lives of their clients. So we thank the Hilton Foundation for their investment in the HPU. We use some of those private dollars to fund staff development, professional development, team building bonuses for staff. And we're really proud of how many staff have stayed on our team since our early days in July 2021. And finally, I just want to touch back on equity considerations. As Janey mentioned, we monitor equity at every stage, every selection stage of our process. So the folks that appear on the list are the same folks who make it through outreach, are the same folks who make it to enrollment, are the same folks who make it all the way through discharge. Want to ensure that we're not losing anybody at any one of those potential selection stages. So equity is top of mind for us. I want to get in a little bit into our participant demographics here. So as you can see across our bars here, our program serves a higher proportion of female clients than male clients. About 64% of clients who enrolled from May 22 to October 23, that's 472 clients. 64% of those clients were female. I want to mention here that, again, our program serves single adults and families, and we find that the heads of household, the identified clients on our family side, are often female. Our clients are 43% folks who identify as being Black, 35% of our folks identify as being Hispanic or Latinx. And so, again, we're measuring our race and ethnicity data up against point in time count data to ensure that as a prevention program, we're working upstream to serve folks who we see disproportionately reflected in the population of people experiencing homelessness here in LA County. Our program overwhelmingly serves folks who are between the ages of 25 and 54. So in the early days, we thought we might be serving an older adult population, but we have seen our clients largely living between that 25 to 54 age range. And as Janey mentioned, our program is still in evaluation, but we have some early, outcomes that we'd like to share with you all, some wins we'd like to celebrate here. So although our clients are challenging to enroll in the first place, we're very proud that 92% of our enrolled participants complete the program all the way through, especially given the levels of risk, the barriers that our clients face. We think that it's remarkable that such a large proportion of our clients stick with the program and receive the full sort of menu of services and support available to them. 5% on top of that 92% we lose contact with, only 3% leave early. And I think that it's a testament to the excellent work of our case managers and support staff on the unit, that clients want to stay and are able to stay all the way through the life of the program. And finally, 86% of our participants have retained their permanent housing at time of program exit. We'll look at long-term data on housing retention and some other indicators of clients' overall health. But I think that this is remarkable as well, that such a high number of our clients retain permanent housing when we say goodbye to them. I'll mention here that, and I didn't mention this in our outreach portion, but we often find our clients in moments of real crisis. They're days away from an eviction. They've just left the hospital. They've just lost their job. There is something pretty incredible about the timing with which we find folks. And I think that for 86% of our clients to have retained their permanent housing, for us to have been able to assist them in resolving those immediate crises, to keep them housed all the way through the life of the program and hopefully beyond, is something that we're very proud of. Thanks, Janey. I think I can pass it back to you if we have time for our evaluation piece.
Sure. No one's kicking us off yet, Dana, so I will
Nice.
go through the last couple slides. Of course, Dana just shared really promising information around client retention and how many people are still housed at the end of the program. The California Policy Lab is also running an impact evaluation that's a randomized control trial to detect the impact of HPU on experiences of homelessness among clients. So we're running an RCT because program demand far exceeds its capacity. So it felt like a good circumstance in which you could equitably randomize people into the program. The randomized control trial began in February of 2023. And of course, if you're familiar with RCTs, you need to monitor minimum enrollment in order to detect the impact. And right now we're on pace to analyze the program's outcomes in 2027. This is partly because of those enrollment challenges that Dana shared earlier. So this is just the basic structure of our RCT. We have this high risk list that's referred to the Homelessness Prevention Unit. If you recall from earlier in the talk, it's about 10 to 11,000 individuals on the high risk list over the course of a year. That is then randomized into treatment and comparison groups. And the treatment group is selected for proactive outreach. So one thing to understand here is that we're not randomizing at the point of program enrollment. We're randomizing at the point of referring to outreach. And then the comparison group has no outreach. So of course, in the middle of your screen, this proactive outreach treatment group, not all of the majority of these people are not actually going to enroll in the HPU. And then we have two different treatment arms after there is enrollment, where we're detecting the difference between enrolling with base financial assistance of $48,000 and enrolling with expanded financial assistance of $6,000 to $10,000. So hopefully in 2027, we'll be able to answer the question of whether this group referred to outreach has different outcomes of homelessness than the comparison group, but also try to detect whether a smaller or larger level of financial assistance is having an impact on people's experiences of homelessness. Thank you so much for listening to us. I think we have time for questions. You can reach me at this email address or our website here. Thank you.
Great. Thank you so much, Janey and Dana. Okay, a lot of the questions that we are getting in the chat from the audience are they're wondering if this is feasible in their communities and how they could possibly get started. Can you share a little bit more with us about how this program came to be in LA? We hear from a lot of communities that there's a real struggle to get further investment for people that may become homeless when there are so many people already experiencing homelessness and not enough resources. Specifically, can you talk a little bit about how did this work get initiated and how were you able to initially secure funding to do upstream prevention work?
Sure, maybe I can start with that, Dana, and then I'll hand it over to you. And I actually think there's like maybe a couple of different kinds of things. I think there's a question there around how do you develop the political will to invest in prevention? And then there's maybe a separate question of how to get started. So on the first question around political will, when we came to Los Angeles, we opened the doors of the California Policy Lab in 2017, and this was our first project. And what was really interesting about that time period is that there was a growing interest in prevention, but a lot of fear that homeless services dollars would be allocated to prevention and that money would not actually support anyone at high risk of homelessness. So, our system is underfunded and under-resourced, so there are real conversations around how to allocate resources. I think this is where philanthropy can be really helpful in developing innovations to make those kinds of investments less fraught. So in homelessness prevention, the initial investment in the predictive modeling project was funded by a foundation and was not coming from government dollars, just to see if we could develop a model that was helpful at targeting prevention. The targeting I have found is critical for developing that political will, because what you're really hearing is we're so worried we're going to spend all this money and see no impact on inflow. If you can try to make the case that investing in prevention will affect inflow and will decrease demand for emergency housing, then the equation is very different, especially for public funders. So I think if I were in a place that didn't have predictive modeling, I'd be really focused on other strategies to target prevention, like screening tools or using evidence-based risk factors that you can ask clients about. And then, and as this project evolved, the county board of supervisors felt like the predictive model had promise. And that's when they made their initial investment in Dana's unit. So maybe Dana, I'll hand it over to you to talk about what those conversations were like.
Yeah, thank you, Janey. I would just piggyback on what Janey shared. Whenever I talk to partners in other jurisdictions who have an interest in standing up similar programs, I always think about how lucky we are to live in a data sharing environment that has allowed this work to take place. We would not be able to as effectively target our resources to the clients who need those resources most absent, critical partnerships and data sharing agreements that are in place here in LA County. But I would just say some targeting is likely better than none. Janey shared that the overlap between our program, the population that we serve, and other referral-based prevention programs is so small. So there's a real need for both. But I think if other jurisdictions can find a way to target in any way, it's worth trying. And I'll also say that we were very lucky to begin this program in the funding environment that we did. Flexibility has been so key in how we have developed our program. Flexibility is so key in the financial assistance that we provide to our clients. And so we began with a small investment of local Measure H funds and a matching investment from the Hilton Foundation. That allowed us a ton of flexibility. And then we received a large influx of ARPA funds that were also very flexible. And so the flexibility in the funding has been key in serving a hard to reach, hard to serve population, and to let those clients really drive the services that they receive with our program.
Going back to that for a second, Janey, in terms of thinking about how to get started, what does the community really need in place in order to implement a predictive model? Thinking from a data and an analysis perspective, one of the questions that we've gotten in the chat is like, literally, do you need like 10 years of HMIS data? We'd be really curious to hear from your perspective, what is needed to have enough sort of baseline data to start this work, and maybe Dana, any reflections you have from like a programmatic implementation perspective in terms of prerequisites for getting started.
So I have a slide here because you can imagine we sometimes get this question. So I think before you even talk about data, I think it's really important if you're a research partner to a public agency or working in a public agency or a nonprofit to really ask yourself, do you actually have a prediction problem? And most of the time when we're asked about building predictive models, we don't actually think that there is a prediction problem there. So let me be a little bit more clear. If what you really want to know are what are the risk factors for people in my community experiencing homelessness, a predictive model is not going to tell you that. You need a different methodology to test whether risk factors are connected to the outcome, either a causal method or maybe testing a survey instrument that you could help, that you could give to people in the field. I think there's another category of where a predictive model isn't going to do a whole lot more. So that's when you have a group that's categorically high risk. So an example of this would be young people aging out of foster care. We did a study here in Los Angeles where the Department of Child Welfare Services wanted us to see if we could predict homelessness among young people aging out. the overall prevalence among every young person aging out was the same risk of homelessness as the people on this predicted risk list, right? So you could spend a lot of time and energy building the IT infrastructure for prediction there, and really what you should be doing is taking those resources and helping every young person exiting foster care try to achieve stable housing. Another example of that might be seniors who are disabled enrolled in safety net programs, right? So like that's a group that's categorically at high risk of homelessness. So first you want to make sure that it's worth spending the effort to build the data infrastructure and that you have a prediction problem. I think, a lot of the questions, as Karen said in the chat, are around what are the minimum data sources to do this? So you definitely need to observe homelessness. That's the outcome you're predicting. The most common way to do that is to look at HMIS data, Homeless Management Information System data. If you're in a community that has a right to shelter, your HMIS data or your homeless services data is probably better at observing homelessness than it is even in California. So if you're in a place like New York City or DC, where most people experiencing homelessness have some connection to government support, you're going to have better coverage. But you definitely want to pay very close attention. Are we able to observe homelessness? And then can you link that outcome data to some source of data that's going to help you assess risk? If you're doing a predictive model, that data to predict risk doesn't need to be perfect, and it doesn't need to be as big and varied, I don't think, as it is in LA. I think more people should test sort of the minimum viable amount of data to predict the outcome. Again, what you're trying to do is make a prediction. You're not trying to explain all the risk factors for homelessness. I think you could test this with maybe utility data. You could test it with just safety net data, for example, without linking safety net data to criminal justice contacts and child welfare data. You could try different, but you need some data that's going to help you assess who's at risk of homelessness. Someone asked in the chat, could you do it with HMIS data alone? I think maybe, but I think it would be very challenging because you're really just seeing people who are already, for the most part, already experiencing homelessness, unless you're already running a huge prevention program in your community that's also entered into HMIS data. So if you have your data sources, the most important thing to ask next is who is going to use this model and how, because the answer to that question will completely change all of your data science strategies. In this case, we're generating a risk list at UCLA and sending it to the county. We have another pilot where we developed the model to run directly in the IT system of the CalWORKS program. So, who is using it and how they're going to use it to target prevention and what services they're offering. You have to answer those questions up front. Otherwise, you could end up building something that isn't usable by your service provider. And then you need to know what your potential clients need. And that's where that partnership of the service provider is super important, because then they're going to need to know the information from your risk list around how to design the program. So it sounds like a lot, but I think that the message here is that it's a collaboration. There isn't one way to do this. There's some minimum things you need, like data on homelessness and data on risk factors. But this could look a lot different depending on your environment.
Thank you. Okay, going to questions around outreach and coordination. Have you found any systemic patterns in which clients are most difficult to reach? And how do you manage or tackle equity concerns when it comes to the outreach, knowing that some populations or communities have a greater mistrust of systems? I think there's particular interest from the audience in thinking about reaching older adults, and any thought that you guys have put into about how to leverage community partners that are trusted and could support reaching some of the harder to reach target participants.
Yeah, thank you. I think that our outreach approach has gotten better and better, but we're still learning a lot in this realm. I want to touch on language, I guess, first. We have been mindful about our ability to do outreach in any language that might be our client's primary language. And so we've got access to a tool called Language Line that allows us to tap into a translator in real time to assist with outreach. If we're calling a client and realize that our staff's language capacities don't reflect the needs of the client, we're able to tap into that both during outreach and throughout the life of that client's time with the program. In thinking about our older adults and our clients who have limited tech resources available to them, tech capacities, we think the letters have been really key. The letters really work for a lot of our clients. So clients who may not be comfortable answering the phone have already received a letter by the time we start making those calls. So we've got the letter in hand, then the calls start coming, and then the email comes as well. So I think it's just a multifaceted approach, hoping that one of those modalities will help our clients feel comfortable. Um, and then we do, for clients who are unable to reach through the calls, through the letters, through the emails, work with collateral contacts where we can identify them, a trusted third party, a mental health provider, another service provider that a client is in touch with. We'll work through that person to get in touch with the client. Will call together, we'll share information with that provider in the hopes that we can sort of do a warm handoff. And then the messaging or the opportunity is coming, in collaboration with that third party. So collateral has been really effective in reaching some of our more skeptical or disconnected clients.
Thank you. I want to go back to a point that you guys both touched on, which is thinking about the different prevention models and how it's not a sort of either or. In our work at the GPL, when we speak with communities that operate prevention programs, most really are relying on inbound requests for assistance or people self-identifying as needing help. You guys said that you don't think that it is necessarily one or the other, and in fact, you actually need to be exploring both. Can you just say a little bit more about your theory about why sort of, having this counter approach to what is maybe the typical is really important, and how you feel like you get to sort of a fuller reach of people you're serving by having both the inbound and this more targeted outbound that you're doing?
I can start, and I'm sure Dana will have a lot to add here, but what the research finding that I shared, where we first observed very little overlap, that was a real light bulb moment for us. We hadn't done this work before. We weren't sure. I think if I had to guess what I would have seen, I would have expected a much bigger overlap. Any theories we have about why these two groups are really just theories, but I'll offer them in the spirit of conversation. I think that the group enrolled in prevention, there might be a couple of things. Prevention as usual. I think one thing to understand about Los Angeles is that the prevention as usual program that we're talking about is connected to the coordinated entry system and run by homeless services providers in their communities. Los Angeles is huge, so there are probably 70 providers providing services, some of which were contracted to provide prevention in addition to crisis housing and street outreach services and other types of homeless services. So the group enrolling in those prevention programs, they might be just better connected to those providers. They might have experienced homelessness in the past and know how to get back in touch with that provider, and then got enrolled in prevention. There are clearly people who somehow, with assistance or not, were capable of navigating through a program that's pretty bureaucratically complex. There's a lot of screening and documentation required. So at a minimum, they have to be able to do that for themselves or with help. And, I think that the group that the predictive model is finding, they have to be enrolled in county services. So if you have no county service touch point, you're not going to be in the data. So that your only option is to go to a program where you can identify yourself as being at risk and getting enrolled, right? So that's one thing that's unique. I think secondly, and this is really where Dana's insights are important, the predictive model is finding people who are way more vulnerable, as I showed, than the people enrolling in prevention as usual. And I suspect that they have a much higher distrust of systems, a larger or deeper experience of trauma that is related to their interactions with public services, for example, and are just less likely, for whatever reason, to be the one to call up and self-identify. So that's kind of what I meant by, whenever you're thinking about equity, there's the actual equity evaluation, but there's also the social context in which you're doing your work, and adding this as a complement to business as usual feels like broadening the pie in some ways to make sure more and different people are getting access to services. Dana, anything you want to add to that about the comparison between these two groups?
Yeah, I think um, I think the most important thing I would add is that in order to connect to a referral-based prevention program, you've got to know that your housing might be at risk. And our clients may not, we're talking about a group of clients who are likely to lose their housing in the next 12 months. So when we meet our clients, that may not be on their radar or fully understood for one reason or another. Or as Janey mentioned, the mistrust might be so vast that connecting to a program or another service when they have been failed systemically before is just not going to happen. So I think the knowledge that housing is at risk for our clients is not always there, and we appear as this program sort of out of the blue. But we're far enough upstream that those kind of puzzle pieces have not clicked together yet. And then I'll also mention for our phenomenal partners at our more referral-based prevention programs, we are a little bit further upstream. So oftentimes to enroll in one of those referral-based prevention programs, because of scarce resources in this space, you've got to have an unlawful detainer in hand, a 3-day notice in hand. So the eviction has to be imminent and very, very imminent, days away. That is not required for clients to enroll in our program. So we're a little bit further upstream. We might be catching folks further upstream who might ultimately enroll in those programs down the road, but we're catching them earlier on.
Great, thank you.
Yeah,
Okay.
there's a direct quote from a client in our report where she said she tried to call these prevention programs, and because she couldn't prove satisfactorily the like imminent loss of housing, she wasn't eligible for them. I'm not suggesting that's common for everyone, but this idea that we have to broaden beyond eviction prevention as prevention is super important. It has to be, it can include that, but it has to go beyond that and be more flexible.
Great. Our final question, and I think if we can just keep answers to 1 minute here.
Sorry.
Across the country, we hear from leaders in homeless response that turnover and burnout is a huge challenge to serving clients. Is this showing up in your work? And how do you think about supporting your workforce in doing this difficult work? Maybe I'll turn it to Dana, and then anything you want to add, Janey, from your observations.
Perhaps my favorite thing to talk about. We believe that if we don't take care of our frontline staff and folks who are providing direct services to clients, the services that our clients receive will suffer. So we try to make sure that our staff, our team members, are having a different professional experience with our program than they may have had in other spaces. They're all coming from other case management roles in large part. We spend a lot of time together as a team, eating together, doing fun stuff together. We invest in our staff's professional development. We try to promote internally where we can. We started as a team of 7 before our investment of ARPA dollars, and now we're a team of 40. And almost all of those original team members are still here. And we believe our clients really benefit from the lack of turnover that we see in this work. And we could not make that sort of singular experience possible absent our friends at Hilton Foundation who have invested in our work and allow us to really take care of our staff. Burnout happens. The work is really tough. Our clients have really high levels of risk and can be challenging at times to work with, but we do everything we can to not only wrap our clients around with holistic support, but have the same approach in taking care of our staff as well.
Great, thank you. That is all the time that we have for today. I'd like to first and foremost thank both Janey and Dana for taking the time to speak with us all today. Thank you again to our Harvard co-sponsors. Special thanks to Emma Kornetsky, our Assistant Director at the GPL, for coordinating today's event. And if anyone would like to attend future Harvard housing events, please sign up for either IHH or JCHS or GPL's newsletter. We will also circulate to all attendees materials, and we'll be posting the event on our respective websites. Thank you all so much.